At first, it can look like nothing. A little more fatigue in the afternoon, a little dizziness when standing up, a strange loss of appetite, a bathroom habit that changes for no obvious reason. Many older adults brush these things aside because they do not arrive with sirens, flashing lights, or unbearable pain. But some of the most dangerous health problems do not begin with a dramatic collapse. They begin quietly. They creep in through small changes that seem easy to excuse as just getting older. Until one day the body is no longer whispering. It is in crisis. And by then, valuable time may already be gone. Aging does bring natural changes, but not every new symptom is normal aging. That is one of the biggest mistakes people make. They assume weakness, confusion, sleep problems, swelling, or unexplained weight loss are simply part of growing older. Sometimes they are not. Sometimes they are the body's early warning system trying to protect you. The sooner these warning signs are noticed, the better the chance of finding the real cause and treating it before it becomes much more serious. Here are 10 silent health warning signs seniors should never ignore. 1. Unexplained weight loss. Many people think losing weight without trying is always a good thing. In older adults, that assumption can be dangerous. Sudden or steady weight loss without a clear reason may signal that something deeper is going on inside the body. A senior who is eating the same way as before, but still losing weight may be dealing with digestive problems, thyroid issues, poorly controlled diabetes, depression, infection, medication side effects, or even cancer. Sometimes the reason is not one major disease, but a combination of smaller problems. Dental pain can reduce food intake. Poor sense of smell can make food less appealing. Loneliness can make meals irregular. Difficulty swallowing can slowly reduce nutrition without anyone noticing at first. The danger is that unexplained weight loss weakens the body fast. Muscle mass drops, strength declines, balance worsens, immunity becomes weaker, recovery from illness takes longer. A person who looked a little thinner a few weeks ago may become frail much faster than expected. If clothing becomes loose, rings fall off more easily, the face looks noticeably thinner, or body weight drops without effort, that should not be ignored. In later life, unplanned weight loss is not a small cosmetic change. It can be an important medical clue. Point 2. Constant fatigue or loss of energy. Everyone feels tired sometimes, but ongoing fatigue that does not improve with rest is different. Many seniors live with low energy for months because they believe it is just part of age. That belief can delay important care. Persistent fatigue can be linked to anemia, heart disease, sleep apnea, chronic infection, thyroid problems, depression, dehydration, malnutrition, kidney disease, or medication effects. In some cases, the body is working harder than it should to keep basic functions going. And fatigue becomes one of the first signs that something is wrong. Fatigue in older adults does not always appear as simple sleepiness. It may show up as no interest in daily routines, lack of motivation, staying in bed longer, moving more slowly, or needing frequent breaks during ordinary tasks. A senior who once walked comfortably around the house may suddenly need to sit down after a few minutes. A person who enjoyed social activities may start avoiding them because they feel drained. This matters because severe tiredness can reduce physical activity, and less movement leads to more weakness, poorer circulation, loss of muscle, and a greater risk of falls. It becomes a cycle. The body gets weaker, so activity drops, and when activity drops, weakness grows. Feeling worn out all the time deserves attention, especially when it is new, worsening, or paired with shortness of breath, pale skin, poor sleep, dizziness, or loss of appetite. 3. Shortness of breath during simple activities. Breathing changes should never be brushed off lightly. If a senior becomes winded while walking across a room, climbing a few steps, getting dressed, or talking for long periods. That can be a serious warning sign. Shortness of breath may point to heart failure, chronic lung disease, asthma, anemia, infection, blood clots, or fluid buildup. Some people notice it only during activity at first, which makes it easy to dismiss. They say they are just out of shape. But when the body struggles to get enough oxygen during basic movement, it should not be ignored. In older adults, breathing trouble can show up subtly. It may look like needing more pillows at night, pausing often while walking, avoiding stairs, sleeping in a chair, or becoming anxious during mild exertion. A person may not even describe it as breathing trouble. They may simply say, "I get tired faster now." That small sentence can hide a major issue. The heart and lungs work together to keep the body alive. When one of them is under strain, everyday life becomes harder. If shortness of breath appears suddenly, worsens quickly, or comes with chest pain, swelling, cough, bluish lips, or confusion, it may require urgent care. 4. Swelling in the feet, ankles, or legs. Many seniors notice swelling in the lower body and assume it comes from sitting too much or being on their feet too long. Sometimes that is true. But persistent swelling can also be a sign of deeper problems involving the heart, kidneys, veins, or liver. Fluid buildup often means the body is having trouble maintaining proper circulation or balance. Heart failure can cause blood and fluid to back up. Kidney problems can reduce the body's ability to remove excess fluid. Poor vein function can lead to swelling in the legs. Some medications can also contribute. The danger is not just the swelling itself. It is what the swelling may represent. Shoes may feel tighter. Socks may leave deep marks. Ankles may look puffy by evening. In worst cases, the skin becomes stretched, shiny, or uncomfortable. Some people also notice weight gain from retained fluid rather than fat. Swelling matters because it can affect mobility, increase fall risk, and sometimes signal that the body is struggling in ways that need treatment. If swelling comes with shortness of breath, fatigue, chest discomfort, or rapid weight gain over a few days, it becomes even more concerning. The body often shows trouble in the lower legs before it shows it elsewhere. That is why swollen ankles should not be treated as just a minor nuisance. 5. Sudden changes in memory or confusion. Mild forgetfulness can happen with age. Walking into a room and forgetting why you went there can happen to almost anyone. But confusion that appears suddenly or worsens noticeably is different. A senior who becomes unusually disoriented, forgets familiar places, struggles to follow simple conversations, or behaves unlike themselves may be showing signs of something serious. Causes can include infection, dehydration, medication interactions, low blood sugar, stroke, vitamin deficiencies, poor sleep, or dementia-related conditions. One of the most important things to understand is that sudden confusion is not normal aging. A urinary tract infection, for example, may cause confusion in older adults before it causes pain or fever. Dehydration can cloud thinking. Medication errors can lead to dangerous mental changes. These problems may look like just having a bad day, but they can escalate quickly. Family members often notice these shifts first. A loved one may repeat themselves more than usual, forget appointments, mismanage medication, leave the stove on, or seem strangely withdrawn. These changes may come on slowly or all at once. When the brain is not functioning as it should, the whole body is at greater risk. Confusion can lead to falls, missed medication doses, poor eating, and inability to seek help. It is one of the clearest warning signs that deserves prompt attention. 6. Changes in bathroom habits. Many serious conditions first reveal themselves through changes in urination or bowel movements. Yet many seniors hesitate to talk about these symptoms because they feel embarrassed that silence can be costly. Frequent urination, burning, blood in urine, constipation, diarrhea, dark stools, or a sudden change in bowel habits can point to infections, dehydration, medication side effects, prostate issues, diabetes, digestive disorders, or colon problems. Blood in the stool or black, tarry stools may even suggest internal bleeding. Constipation is especially common in older adults, but that does not mean it should be ignored when it is new, severe, or persistent. It can result from dehydration, low fiber intake, inactivity, certain medications, or more serious bowel issues. On the other hand, sudden diarrhea or urgency may suggest infection, medication intolerance, or bowel disease. Urinary changes can also say a lot. Getting up many times a night, leaking unexpectedly, struggling to start urination, or having pain may reflect infection, bladder problems, prostate enlargement, or nerve issues. Some seniors reduce their water intake to avoid bathroom trips, which can make things even worse by causing dehydration. The digestive and urinary systems often reflect overall health. When their patterns change for no clear reason, the body may be signaling a problem that should not wait. 7. Dizziness, faintness, or balance problems. A brief dizzy spell may seem harmless, but in older adults, it can be one of the most dangerous warning signs because it often leads directly to falls. Falls are not small events for seniors. One fall can mean a fracture, surgery, loss of independence, and a long recovery. Dizziness can come from dehydration, low blood pressure, heart rhythm problems, inner ear disorders, medication side effects, low blood sugar, anemia, or neurological issues. A person may feel lightheaded when standing up or unsteady while walking. Some describe the room as spinning. Others just say they feel off. These symptoms should never be treated casually, especially if they are frequent. A senior who holds onto furniture more often, walks more slowly, or avoids getting up quickly may already be compensating for a balance problem. That is the stage where many people say nothing until the fall finally happens. Balance changes can also be connected to vision decline, muscle weakness, foot problems, or nerve damage. The cause may be simple, but it may also be serious. Either way, it deserves attention before injury occurs. If dizziness is paired with chest pain, weakness on one side, slurred speech, severe headache, or fainting, it may be an emergency. 8. Loss of appetite or difficulty eating. A reduced appetite is easy to miss because it often happens gradually. As senior starts eating less at breakfast, they leave more food on the plate. They skip lunch. They say they are not hungry. Over time, the body pays the price. Poor appetite can be linked to depression, medication side effects, dental problems, digestive disease, infection, altered taste, swallowing difficulty, or underlying illness. In older adults, eating less does not just lead to weight loss. It can cause weakness, vitamin deficiency, muscle wasting, poor immune function, and slower healing. Difficulty chewing or swallowing is especially important. Some seniors avoid certain foods because they are painful or hard to manage, but do not mention it. Others cough while eating, clear their throat often, or feel as if food gets stuck. These are not symptoms to ignore. Swallowing problems can raise the risk of choking or aspiration, where food or liquid enters the lungs. Food is fuel, but it is also protection. When a senior consistently eats too little, the body becomes much more vulnerable. Illness hits harder. Recovery takes longer. Energy disappears. The person may look okay for a while, but inside, their reserves are shrinking. A lasting drop in appetite is not just a routine part of aging. It is often a message from the body that something is wrong. 9. Skin changes, easy bruising, or wounds that heal slowly. The skin can reveal health issues long before other symptoms become obvious. Seniors and caregivers should pay attention to changes in color, texture, Bruising and healing. Easy bruising may happen more often with age because skin becomes thinner, but excessive bruising can also point to medication effects, vitamin deficiencies, fragile blood vessels, or blood-related conditions. Yellowing skin may suggest liver problems. Pale skin can point to anemia. Bluish skin may signal poor oxygen levels. Very dry or itchy skin may reflect dehydration, circulation issues, or other medical concerns. Slow healing cuts or sores are especially important. They may suggest diabetes, poor circulation, nutritional deficiency, or infection. A small foot wound can become a major problem if it does not heal properly. Pressure. Sores in people who sit or lie down for long periods can also become dangerous quickly. Skin is the body's outer warning system. A new dark spot, a mole that changes, an area that bleeds easily, or a sore that never fully heals can even be an early sign of skin cancer. Many people delay evaluation because it does not hurt. But pain is not always the first signal of danger. When the skin starts showing unusual patterns, it should not be dismissed as just cosmetic aging. The body may be revealing important information on a surface. 10. Persistent pain or pressure that is not quite normal. Pain should never be ignored just because it is not severe. In older adults, persistent discomfort is often minimized. A person says their chest feels a little tight, their back aches more than usual, or their stomach feels strange sometimes. These vague symptoms may seem too mild to matter, but some of the most serious conditions begin this way. Chest pressure may not be dramatic, yet it could reflect heart trouble. Ongoing abdominal discomfort could point to gallbladder disease, ulcers, constipation, or something more serious. New headaches may signal blood pressure problems, medication issues, or other neurological concerns. Back pain that will not go away can come from posture and strain, but in some cases it may reflect fractures, kidney issues, or disease affecting the spine. Older adults do not always experience classic symptoms. A heart attack, for example, may not begin with crushing chest pain. It may show up as fatigue, nausea, jaw discomfort, shortness of breath, sweating, or a feeling that something is deeply wrong. This is why not quite normal should still be taken seriously. Pain is the body's alarm, but in later life, the alarm does not always ring loudly. Sometimes it hums in the background, easy to ignore until the problem becomes impossible to miss. Final thoughts: the most dangerous health problems in seniors are not always the ones that arrive dramatically. Often, they begin quietly. A little swelling, a little confusion, less appetite, more fatigue, a little shortness of breath. These signs can seem too small to matter, especially when life is busy or when a person believes aging explains everything. But aging should never be used as a blanket excuse for symptoms that are new, unusual, or getting worse. That is the real message here. The body speaks before it breaks. It warns before it collapses. Seniors, family members, and caregivers should learn to respect those warnings instead of waiting for a crisis. Paying attention early can mean catching disease sooner, preventing complications, protecting independence, and in some cases, even saving a life. No one needs to panic over every small symptom, but no one should ignore clear changes either. When something feels off, especially if it persists or worsens, it deserves attention. Listening early is often what makes the difference between a manageable problem and a medical emergency. For older adults, health is rarely lost all at once. More often, it slips away through signs that were noticed too late. That is why these silent warning signs matter so much. They are quiet, but they are not harmless.